102. My name is Dr. Philip Ross. I'm a chiropractic physician here at the World of Wellness. And today we're going to be diving in, and I titled it Reaching Optimal Performance with chiropractic care and the conjunction therapies we have over here at the Wellness Center. So, my background, I am a chiropractor, but I also went for a master's in sports rehabilitation. And just a couple years ago, I actually went and got my CCSP, and that stands for a Certified Chiropractic Sports Physician. What that basically means is I just feel very, very confident treating athletes and getting them to return to play a little bit more efficiently and quicker than other practitioners. But also, we kind of use those same principles with treating athletes just to the general population. So, whether it's that you just want to be able to get on the floor and play with your grandkids without any kind of pain, that's an athletic movement. If you want to golf pain free, if you want to improve the quality of your golf game, we basically though go through functional movement screens just because we want you to be optimal. That's the main thing. So you don't necessarily have to be in pain or suffering from any kind of injury, but basically just to improve your quality of life, just so you have a better life. So we'll just get right into it. So this is basically talking about my schooling and where I worked from before. And also, what I left out is I'm TPI certified. So, the TPI basically stands for Titleist Performance Institute. I really like doing that because it essentially takes you through the 16 biomechanical movements of a golf swing. And you kind of break it down literally from neck down all the way to your ankles. And you see where you are lacking range of motion. And we check different tissues to see if you're just too tight in one area, if you can't get your hips around, if you're lacking thoracic mobility, we'll basically treat you in the room and then we'll give you corrective exercises and stretches you could do at home just to basically golf a pain-free round and just improve your range of motion through the golf swing. So, and I'm going to be touching base and talking a little bit more about that on Friday, I believe at 11 a.m. So, what we're going to get in today. First off, just want to thank Jamie Nutritional Frontiers for putting on these events. These are awesome. The coolest part about this is you get to see walking testimonials coming through the door every single day. That makes my job a lot easier because I do not know everything about supplements and nutraceuticals. I'm trying to learn every single day, but it's really cool when you get patients coming in and, oh, doc, I tried X, Y, and Z, and you know what, my knee's feeling better. I just feel like my nervous system down regulated. I feel calmer. And so it is really, really cool to see patients coming in and getting results basically from Nutritional Frontiers, the supplements. And I don't even like calling them supplements. I think they're beyond that. I think they're nutraceuticals. It is professional grade supplement. And we really get to see what truly works and what doesn't work here. And with the help with Nutritional Frontiers, I'm starting to get a more comprehensive knowledge of basically the pathophysiology of what the ingredients in the supplements are and basically how they're affecting your body. So the goal today, a couple goals. We're basically going to show you how our patients are getting crazy results, whether it's getting out of pain or just improving their quality of life. Just take you inside the treatment room, show you what we do in the treatment room, and then I'm going to talk a little bit about my favorite supplement protocols for certain therapies and certain conditions. And then I'm going to talk about two main musculoskeletal injuries. Being a chiropractor, I think we definitely have to talk about low back, and we're going to kind of go into the pathophysiology, what happens in a disc bulge or a disc herniation. And then we're also going to talk about tennis elbow, which is also called lateral epicondylitis. So, in the treatment room, athletes of all ages, whether you're a high school athlete, collegiate athlete, professional athlete, or just a weekend warrior, you like to go golf on the weekends, you're in a tennis league, we're basically trying to get you to perform as optimally as you can. We do this by a couple different things. We could take you through functional movement screens to kind of assess your range of motion. We could compare side to side, and then we could assess your spine. We do chiropractic adjustments, and then we also do a lot of myself and Dr. Orbach trigger point release and kind of soft tissue work. So there's multiple ways that you could work on soft tissue. So just my philosophy is as a chiropractor, I love adjusting people, right? Just to restore motion into fixated segments in the spine and extremities. However, all your soft tissue, whether it's a ligament, tendon, or muscle, is going to be attaching to an osseous structure, so like a joint. So if we put motion into joints and facilitate motion into certain segments, if we don't treat the tight or hypertonic muscles, tendons, or ligaments attaching to certain structures, you're basically missing half the battle. So that's where myself and Dr. Orbach, we do a ton of soft tissue work just because I feel like you're missing literally 50% of it if you're just treating one and not the other. So it's a total comprehensive treatment when you're coming in here. And we do stuff called pinning and stretching. Basically, just going to elongate the muscle. We also do some PNF stretching, cupping therapy, Graston technique, which is basically just kind of looks like a glorified butter knife. It's going to help break up any kind of scar tissue. And then I'm going to dive into what a lot of patients are benefiting from, and that is a class 4 therapeutic laser. So we're going to start, since I'm a chiropractor, basically with what chiropractic does for your body. So we're going to kind of dive into what it does for your nervous system, and then more importantly for brain function. So this is a study that came out in 2007. This talks about sympathetic and parasympathetic nervous system response. So this was a pretty cool one. So to break that up, sympathetic is you see a bear in the woods. So the fight or flight response, right? So your eyes are going to dilate, all your vessels are going to vasoconstrict, blood pressure goes up. That is the sympathetic. And then parasympathetic is rest and digest. So after you eat a big meal and you're sitting on the couch just watching TV and everything kind of just down regulates, that is your parasympathetic state. So, unfortunately, in today's day and age, I feel like a lot of people are running sympathetic overdrive. So what's pretty cool about chiropractic is if you get a cervical spine adjustment, it's going to increase your parasympathetic nervous system response. So it's basically going to down regulate your nervous system. So if you were dealing with stressful life, a lot of things going on in your life, a lot of moving parts, suffering from anxiety, depression, receiving a chiropractic adjustment to your neck is actually just going to overall improve your mood and instill that parasympathetic nervous system response. So that was pretty cool what it does for the nervous system. And then we're going to talk about the brain function here. So this article basically talks about what it does for your brain. So there's something called your prefrontal cortex. It's they call it your executive function of your brain. When you receive a cervical adjustment, it basically instills and like facilitates the prefrontal cortex in your brain, and that's a huge role in cognitive function. It actually helps modulate dopamine, and it helps with memory and cognition as well. So this is just a slide kind of just reiterating that the nine main functions of the prefrontal cortex. So if you want higher brain function and want your brain to be turned on all the time, wouldn't hurt to get adjusted, Phil. I don't think so. All right. And then also what chiropractic does for your body. Something called proprioception. So proprioception is a fancy word for where your body feels where it's at in space. This is massive for athletes, but I'll kind of tie it in how it could just work for everybody else as well. So proprioception, where your body feels at in space. So when you get adjusted, and on the slide here, is that up? Yeah, so that's Paul Pogba, when he used to be good before he went to Man U and then kind of became a bum. That's the reason I like this picture is because if you see he's turning the corner on Yaya Toure, who's sitting on his rear end there. Basically, if you look at his left foot, how it's planted, if he doesn't have good joint position sense or proprioception, he's definitely going to fall when he turns that corner there. So most of those actually all those athletes overseas in Europe, they all have a team chiropractor that get adjusted. So whether it's neck, mid back, low back, they're also getting their extremities adjusted as well, because when you put motion into a joint, a fixated joint, that's when it's going to increase your proprioception, so how your body feels at in space. And I believe it is the Green Bay Packers. I think it's in their contract if they don't get adjusted in the off season once a month, that I think they actually get fined, which is pretty crazy. So all 32 NFL teams have a chiropractor on staff, just because of what it. I mean, they're getting in kind of small car accidents when they're playing ball. So just to kind of heal, but also what it does for the joint position sense. So you just feel better in your body. So that's massive for athletes, but how that could also help as well, just for everyday people, diabetic neuropathy. Your A1C is close to 10, a little bit over 10, and you just feel like your feet, you just don't feel connected with your feet. Just getting worked on just with any kind of manipulation to your feet. I'll talk about how the laser therapy kind of helps with the neuropathy symptoms as well. Older age, if you're just getting up there in years and you just feel like you just don't feel comfortable in your own skin, basically when you get adjusted, it's going to again increase your proprioception, so your joint position. So you're just going to feel better in your own skin and just feel a little bit more stable, if you will. Okay, so now we're going to dive into the class 4 therapeutic laser. And the fancy term, you guys at home watching, if you want to look it up, if you go into PubMed or Google Scholar, the word you type in is photobiomodulation. And that's where you're going to find all the current literature and research about what laser therapy does for your body. So the best analogy for patients, is how I like to tell patients is think of how the sun hits a plant for the plant to grow and heal. With the laser, we're basically donating photon energy to the cells in your body so you could heal roughly 100 times quicker than what you normally would. Um, there are a couple of different types of lasers. So there's class one laser all the way up to class four. So a class one laser is essentially like a laser pointer that you could go get at the mall. And then we have the Rolls Royce over here. We have a class four therapeutic laser. A lot of chiropractors have, it's called a class 3B, and I'll just kind of go into the specifications. So a class 3B laser is essentially a cold laser, so you don't feel any kind of like thermal effect from it. And most class 3B lasers only treat up to 30 watts. The cool thing about ours being a class 4 pinnacle laser, it actually treats up to 60 watts, and it's a continuous wavelength. So the class 3B is 30 watts in its pulse. So we will treat for a second, turn off for a second, treat for a second, turn off for a second. And the class four is a continuous, so it's treating every single second, and it's literally double the power. So we get way quicker results with patients, either whether they're in pain, suffering from an injury, healing a disc, healing any kind of torn tissue. We get way better results with the class four laser just because it's literally double the power and it's a continuous wavelength. So your treatment time is a lot shorter than other lasers, and it just has a way better therapeutic benefit. There are a couple contraindications for class 4 laser therapy. The main ones is you cannot laser over a spinal cord stimulator or a pacemaker. If you're pregnant, I never laser any pregnant women. And the last one is if you have like a malignant tumor. So there are studies of basically doctors that are treating patients with cancer, but as long as you stay away from the site of the site of the tumor, you're totally fine, just because it's going to help with cell regeneration. And so the fancy word we were talking about, photobiomodulation, is essentially the photon's energy effect on tissue. And so what happens is the it looks like a red light, and the red light, when it hits your skin, if we go back to eighth grade biology, the mitochondria, the powerhouse of the cell, what happens is the photon energy goes into the mitochondria and hits something called a chromophore. It's a photosensitive receptor within the mitochondria, and then you have all the biochemical changes occur. So this is just kind of a list of like all the different effects that the laser has. The biggest thing is mitochondria being the powerhouse of the cell. When it hits that chromophore, you're going to have an increase of ATP, so adenosine triphosphate, so your cellular energy. So essentially, you're going to create newer and healthier cells, just so you could heal a little bit quicker. It also allows for an increase of nitric oxide and O2 perfusion across the cell membrane. So you're basically going to vasodilate the blood vessels so you could get your own body's blood and natural stem cells to the area to heal quicker. And then it's also going to help with oxygen utilization as well. Um, there was actually a study I just read. This was a couple weeks ago, for bone formation, for bone proliferation, and to actually increase your body's natural stem cells. Actually, lasing over your tibia, so your shin bone, which I thought that one was pretty cool too. So, and it also alters pain thresholds, and it has an increase of your growth factor as well. And the cool thing too is about having the class four laser. We were talking about how class threes are cold lasers, so you don't feel it. The class four laser, since it's so powerful, you actually get like you get heat is produced just from tissue saturation. So when the photon energy hits your tissue, you're going to feel the warmth because there's a lot of biochemical changes occurring, and that actually makes my job a lot easier. So usually when I have a patient coming in with any kind of injury, I will laser them first to kind of heat up the tissue, because most of this skeletal muscle tissue we're working with is all collagen based, and collagen becomes a little bit more pliable or mendable when it's heated to around 100 degrees. So when we heat the tissue up, and then when I do some soft tissue therapy over top of it, the same analogy is if you're trying to bend cold rubber as opposed to warm rubber, it's just going to be way easier to kind of mend that tissue, get rid of the trigger points, and get that tissue, that muscle, tendon, ligament, whatever we're dealing with, back to its natural form, natural structure. Um, and then this talks about the cytochrome C oxidase and hemoglobin. So basically, what it is doing, cytochrome C is massive in the electron transport chain. So it's basically talking about what it does for energy here as well. And this is just another list of basically what the laser does for your body. So essentially, it is literally allowing you to heal 100 times quicker than what you normally would. I use this on a ton of different things. There's a laundry list and the specifications of the laser. So whether it's from plantar fasciitis, peripheral neuropathy, they have settings for that. Shingle flare up, TMJ, large joints, medium sized joints. There's just a ton of different implications you could use for it, and then it also works on the nerve. So I'll talk about how it works on the nerve when we go over what it does for the disc here. So the take home is, and actually how I started using the laser when I was in grad school in St. Louis over at Logan University. We were learning about this in school, and I was like, that's just a red light. That's not doing anything. Until we were in clinic and we had a quadriplegic come in, and he was a diabetic and he had an open wound on his heel. And he went to every ologist you could think of basically to try and save his foot before he had to get his leg amputated. And so he came into our clinic last ditch effort because he tried everything, and he came in and we lasered his heel for 10 minutes twice a week for 15 weeks, and it literally closed up the wound in his heel so he did not have to have his leg amputated. So that completely changed my thought process when this is just a warm light, you're just getting some heat from it, to this literally healed this guy's wound and he's not going to have his leg amputated. And that's actually what the laser was kind of created for, was wound healing and basically just like tissue regeneration. So it will also have an effect. It will have an effect for reducing acute inflammation. Chronic inflammation is a little bit different. That's when we're going to have to get into some supplementation, and then it will kind of help restore your normal cellular function. So we're going to now talk about two common pathologies that me and Dr. Orbach treat a lot. And let's just dive into a disc. So this is basically the anatomy and the makeup of a disc here. So, disc model, you basically, I call it the jelly inside the jelly donut. So you have, it's called your annulus fibrosus, and then that basically contains 22 to 24 lamellar rings that keep the nucleus pulposus, which is basically the gelatinous structure inside the disc. I've never felt one, but surgeons say it kind of feels like the same consistency as toothpaste in there. So what happens in a disc bulge or a disc herniation is those 22 to 24 layers, they're avascular. So usually you'll have micro tears in there before, and you won't really feel any pain until the last straw that broke the camel's back. And then you have your huge disc bulge and then the cascade of all those different events going on. So um, this is basically, again, just kind of showing what's going on with the disc. And this is a model of like a disc herniation. So if you look at the MRI on the left, that is a full blown disc herniation in L4, L5. What happens in a disc herniation? Those 22 to 24 layers kind of wear down over time. And we'll talk about the most provocative motion for a disc is flexion and rotation. So anybody that has had a history of having a bad back, literally the worst the worst motion you could put your disc in is literally bending at the waist and then twisting to pick something up. So that's where me and Dr. Orbach kind of help people in the clinic, is basically just kind of teaching them good posture. Like if you're going to go pick something off the ground, or if you're moving something out of the trunk of your car into your home, moving anything at home, basically just how to have good posture so you're not putting your disc in a compromised position, because it is very easy if I just drop my pen to just kind of lean over, bend to the side and pick it up. But over time and over years, you keep doing that same repetitive motion that is not good for a disc. That's when you have micro tears of those lamellar rings, and then that jelly kind of squeaks out of the donut, and then you're basically going to have your all your symptoms coming from the disc herniation. So, and then the pecking order for pressure on a disc. So actually it's more common for me to see disc bulges and disc herniations from patients that are sitting all the day, because you actually have the most pressure on a disc in the seated position, second most laying prone, so laying on your belly, third most seated, and then standing, and then you have the least pressure on a disc laying on your back. So a lot of people coming in with like a hot disc in their low back, they're like, doc, just when I'm laying on my back, I have relief. But when I'm sitting, getting in and out of my car, getting up from a seated position, it's just crazy painful. And that is basically because you have the most pressure on a disc in the seated position. And when we talk about a disc herniation or a disc bulge, there are two components, and I like to treat both. So you have a physical component, and then you have the chemical component. So we were talking about the jelly inside the jelly donut. When that actually gets out of the disc, it contains 8 main inflammatory proteins. We'll just call it chemical soup. So when that chemical soup hits the nerve, it fires the nerve, and the nerve actually swells almost 3 times its normal size. So you have, it's called an IVF. It's basically just a hole where the nerve exits. If you have a swollen nerve, and then you have the pressure basically on the nerve, just because it's swollen entering that or leaving that IVF, that's when you get your classic pinched nerve in your back, and then people have the radicular symptom, the radiating symptom down their leg. And so we were talking about treating the physical and the chemical component. So we will start with the physical. So the physical component is corrective exercises. There's something called McKenzie's protocol. Myself and Dr. Orbach are relatively, we know about that protocol, and that is literally the gold standard for healing any kind of. It's, the technical term is a lumbosacral radiculopathy. So it basically just means low back pain running down your leg. There's a huge protocol for that, and myself and Dr. Orbach, we take patients through that, and so we're trying to take pressure off the disc and then give you different movements and stretches you could do at home, basically just to increase your healing capacity. And when we get to the chemical component, we were talking about the chemical soup, that chemical inflammation that hits the nerve. I really like to use our transdermal CBD. So what separates our CBD from all these other CBD companies is that we have lipoderm technology. So how I explain it to patients is, when you go, if you ever heard of any woman that went for hormone replacement therapy and they go to their endocrinologist, and the endocrinologist is like, hey, we're going to give you some cream for estrogen or progesterone. You're just going to rub on your skin, and that's how you're going to get your hormones in. We have the same technology, that lipoderm technology, with the CBD. So it's not a placebo. It actually gets into the target tissue. And then you're going to have basically all the healing. So CBD in its nature is an anti-inflammatory and a neuroprotectant. And coupled with the lipoderm technology, it kind of helps the molecular structure of the cream, actually helps it get into your skin. So again, it's not a placebo. You actually get like relief from our CBD. So if you've never tried it, it's no joke. You should definitely come give it a try, because I mean, like I was telling you guys earlier, I have walking testimonials coming in every day. And it's cool when I give someone a sample of the CBD and they're like, yeah, I just thought, what the heck, I'll try and put it on my elbow. And they're like, man, I put that on my elbow. My elbow felt great for a couple of days. So it truly works. So I use the topical CBD, and then what we were talking about with the laser, it kind of reduces acute inflammation. So we'll actually use the photon energy as a driver to kind of drive the CBD into your back, basically just to kind of decrease all the inflammation of your disc. A lot of questions I get from patients is, well, I just feel like on my skin, the heat, is it actually like getting to my disc? Absolutely. So the 60-watt laser actually penetrates 2.42 inches into your body. So we could definitely treat the target tissue that we're trying to treat, just because it's such a powerful laser. And again, this is kind of just another model of like what's going on in a herniated disc and how you get that pinched nerve. Again, it's all inflammatory. So when you have the low back pain, so like a disc bulge, disc herniation, pinched nerve, is kind of all one and the same. When patients are like, I'm feeling the back pain, but I feel kind of radiate into my butt or down my hamstring, behind my knee, all the way down to my foot, how the laser could kind of help heal the nerve. So you have 3 channels on a nerve. You have a potassium, a calcium, and a sodium ion channel on the nerve. When people have the radicular symptom kind of running down a leg, think of a straw with a bunch of holes in it. It's a damaged nerve. It's leaking. So it keeps depolarizing. So you keep feeling that pain radiate down your leg. What the laser does is, the calcium ion channel on the nerve, the laser actually goes on the calcium ion channel on the nerve and kind of patches up the holes in the straw. So it's just a better signal, better connection, so you don't feel the radicular symptom. So not only can you use the laser to treat the chemical component of the disc bulge, the disc herniation, but you could actually use it to treat the calcium ion channel on the nerve to kind of heal the nerve, so you do not feel the radicular symptom firing down your leg. Um, and then what we could also do in the office after lasering, supplement protocol for that, X-Flame. Absolutely love the X-Flame. I think that's one of the best natural anti-inflammatories on the market, actually. So I will have people take X-Flame, and then the neuropathies as well, just because the high B12, just to kind of help for nerve regeneration as well. And then I was talking about earlier, myself and Dr. Orbach do some of the McKenzie protocol. It's basically giving you corrective exercises, at home, just to take, so your body's not in those provocative motions and loading the disc while the disc is healing. And then we also do stuff to hit something called a mechanoreceptor. So I'll just get into this real quick. you have something called a mechanoreceptor, and that is basically from like it's called a Pacinian corpuncle. You have Ruffini corpuncle. So basically, they're for 2 point discrimination, deep touch, light touch. And so when you stimulate mechanoreceptors, when you experience pain, it's something called nociception, and that is a type C fiber, unmyelinated. So it's a slow signal to the brain. So, say I just bump my knee on the table right here. My nociceptors are going to say, "Hey, that hurt. That was painful." We're going to send a message to the brain back down to my knee, and you're going to experience pain. When you stimulate mechanoreceptors, that is a type 1A myelinated nerve. So that is the highest pecking order. That's first dibs to the brain. So when we do things to stimulate the mechanoreceptors, such as cupping, pinning, and stretching, if we do any kind of FST or any kind of like Graston or that instrument assisted soft tissue mobilization, you are stimulating your mechanoreceptors, and that's overriding your pain signal. So that is just a temporary fix to get you out of pain. I'm not about chasing pain. I'm actually trying to get to the root cause. But when people come in and they're flared up and they have a pretty significant disc herniation, you definitely want to get them out of a pain. And then you also always obviously have to heal the disc itself. So that's just how we do things differently here. This is not one of the places you come and, oh, I'm just going to adjust your neck and your back and then you're out of here. We're treating not only the physical component, but we're also treating the chemical component. And then I always like to tell patients, hey, I love seeing you in the clinic, but I would rather see you at Giant Eagle at a concert. So I like to get people better as quick as possible, just so you're not coming in a zillion times. Because I hear a lot of times for patients, yeah, I went to a chiropractor before and they wanted me to come in 3 times a week this month, twice a week the next month, and so on and so on. And I'm not about that. Just with the tools we have here in the nutraceuticals, the supplements, you should be feeling better in 4 to 6 visits. And if you're not, then we could definitely do different studies. So we could send you for an X-ray and MRI. We could do lab work, and then a little bit later with myself and Joe Messino, we're going to be talking about the KBMO FIT test, and that is FIT stands for a food inflammation test, and how that's very unique compared to a lot of other different tests out there. So, and what I was talking about earlier, the nutritional support for the disc herniation, we were talking about the lipoderm technology in the CBD. Like, that is absolutely no joke, no placebo there. And then the X Flame to decrease inflammation. Then we also have Inflame as well. And now we're going to dive into the second musculoskeletal component, or condition that we treat, I see pretty often. Lateral epicondylitis basically just stands for tennis elbow. And it's kind of funny because tennis elbow is on the outside of your elbow, so out here, and then golfer's elbow, medial epicondylitis, is on the inside. Depending on your golf swing, there's a lot of patients that are coming in actually complaining of tennis elbow as opposed to medial epicondylitis. And we could dive into that on Friday when we talk about the TPI. But yeah, essentially what lateral epicondylitis, I'm just going to call it tennis elbow, it's a little bit easier to say, is basically an overuse injury of your elbow. And actually, more importantly, like the extensor muscles of your forearm. So you have a bunch of extensor muscles on your forearm, and they attach to the bone up here. That is that lateral epicondyle. So if you were just doing the same repetitive motion day in and day out, and your forearm starts to get tight, what happens is you're basically, your muscles are pulling on that lateral epicondyle. And then lateral epicondylitis, the suffix of that word, itis, means inflammation. And then you get an inflammatory response on the bone where all those extensor muscles basically originate from. And so when you have the inflammation, then it's going to be a pain generator. This is a relatively easy one to fix for most patients. So what we do is we're going to do a ton of soft tissue therapy to kind of loosen up all the extensor muscles on your forearm. So essentially to put more slack in the rope so they're not pulling on the bone. And then when we couple that with the X Flame, the transdermal CBD cream here, just the anti-inflammatory, and then get some laser therapy on it. Once you decrease the inflammation and put more slack in the rope, so to speak, in those muscles, the tennis elbow is completely gone. I don't know. I think Kevin would be all right if I share this. Kevin in the back, he was suffering with this for a couple weeks, like a couple months. I can't remember. And I think it was literally, I think 3 visits. I just treated him over my lunch, or if I had to cancel, I'll treat him real quick. And once we stripped out some of those muscles in his forearm, and then got the transdermal CBD, and then kind of laser therapy for, I think it was 3 visits. Shoot, I haven't heard him talk about it in a couple months now. So that's a relatively quick fix if you treat it right. And so and actually, you don't have to be a tennis player, you don't have to be a golf player. We were talking about the same repetitive motion. I got a guy who services trees. He complains about it all the time. And actually, believe it or not, a lot of people, I call them desk jockeys, people like an accountant that are just working, typing on a computer 40 to 50 hours a week. If your hand, and if you're just doing the same repetitive motion over and over again, those muscles are going to get tight, and then they're going to pull in that lateral epicondyle. So personally, what I like to do is kind of pinning and stretching. So it's going to be hard to show you here, but basically the pinning and stretching, you shorten the muscle, pin it, and then stretch it back out just to make it a little bit longer. So I'll do some pinning and stretching, and then I'll also do some neuromobilization. It's basically called a nerve floss. And then I like to do that instrument assisted soft tissue mobilization. That basically just looks like a large butter knife that you kind of go over the muscles just to kind of take down the hypertonicity of the muscle, just allow it to relax. So again, it's not pulling on that epicondyle. And then this is a little bit about the X Flame. So this is everything that has in it. And what I like about the X Flame is it has that cayenne pepper in it, just to kind of help with absorption. So you're actually like assimilating and absorbing everything in the product, and nothing's getting wasted. And it also has DMG in there, and we could discuss DMG a little bit. DMG stands for dimethylglycine. It's a methylator, so it's basically just going to help deliver oxygen to different processes in your body. So that actually is in the X Flame as well. And I try and tell most patients, why our supplement is superior. And again, I like to call it a nutraceutical, not even a supplement. They can't put any more ingredients into these products. They literally put everything they can into them, and I think that's why people get crazy, outstanding results. And this is actually just a patent on the main formulation in the X Flame. And this one was pretty cool. So this basically talked about someone with ankle and foot pain. And after taking this, it was a double blind placebo study. They literally had 100% reduction in ankle and foot pain, which is absolutely crazy. So that was a cool study that I like to see. And then the other one, just for overall joint support, the HA plus. And so when I first saw this, I know the pecking order, you have your hyaluronic acid, glucosamine, MSM, and chondroitin. And I was thinking, because I looked at the back of the label, I was like, wait a second, I don't see chondroitin in there. But the BioCell type 2 collagen actually yields chondroitin sulfate. So that is literally your top four all in one. And why I recommend this for people too, because they're like, well, I was taking MSM, or I was taking glucosamine. Is that all right? Yeah, that's all right. But why don't you take the 4-in-1? So Nutritional Frontiers made it easy for myself and for patients to literally just grab a bottle of this, and usually around like 4 capsules a day up to 6. If you do that, if you're in your acute stage, that's really going to kind of like decrease your joint irritation. This will settle down your arthritis if you have a flare of a knee, hip, or ankle, or shoulder, anything like that. And it's basically just going to help prevent the progression of any kind of osteoarthritis. So it's going to help for joint flexibility. It's going to help for your collagen and cartilage health, and then it also helps promote healthy skin with the hyaluronic acid. And then this is basically just a table talking about the type 2 biocell collagen we have, and basically compared to the other forms. Again, when I was talking about Nutritional Frontiers can't put any more ingredients into their supplements to make them any better, they truly do. They use the top notch, top quality ingredients in their formulations, just so you truly get the therapeutic benefit. It's no placebo there. And so what I do in the room too is, and those are all the muscles. So this is a good model of, we're talking about the forearm. So all these different muscles that are attaching to that lateral epicondyle, the red circle. So when we loosen up all those muscles and put more slack on them, they're not going to be pulling on that lateral epicondylitis, creating inflammation. So you're not going to have any pain. So I also use cups on there as well. And then we were talking about the pinning and stretching. So as a whole, we are not chasing pain. What I'd like to pride myself and Dr. Orbach as well is, we look at the person as a whole, and then we're not going to chase the pain. We're actually going to treat the pathology first, and then all the symptoms are going to kind of go away. Just with the disc herniation. So a lot of times patients will come in and be like, doc, it's actually my behind my knees killing me a lot. Can you work on that? Yeah, we can, but you're not going to get any effect from it. We actually have to treat the root cause of everything going on, just so your symptoms then will kind of heal, and they'll just diminish greatly. So, and that was kind of my presentation in a nutshell there, Phil. So, yeah, that's basically like what we do in the treatment room. if no one's ever been here before and would love to get treated here, I promise you, you will feel a million times better leaving our room. Just because, again, it's not one of those places you go in and you're just getting adjusted and walking out the door in 5 minutes. This is very comprehensive. I do lab work. We'll send you for images if need be, and we'd like to think outside the box here. So, just with my background, I like to do a ton of soft tissue therapy. So what we were talking about earlier is, if we just adjust you and put motion into fixated joints, if we don't treat the soft tissue and also the chemical component to certain things, you're not going to get better. And so it is really cool as well when people come in, or I'll send them for lab work. And let's just actually, this is a true story. Patient I just started treating 4 or 5 weeks ago. His A1C was over 14. He saw myself and Jeff, and he got on 4 different supplements, changed his lifestyle, changed what he put in his body, and then he came in and he said his A1C 2 months later was actually, I think, in the six. I think it was like 6.2. So he literally dropped, yeah, he dropped from a 14 to like low sixes, just with a couple lifestyle changes, dietary changes, and then getting on a certain supplement protocol as well. So it's so cool having the supplement store over here, because it makes my job a lot easier. Because if people truly want to change their life, there's only so much we could do in the treatment room. But with the nutraceuticals and the professional grade supplements we have, when the inflammation goes down and you just tweak a couple different things, people get better so quick. So that's what I like seeing. I truly feel I'm put on this earth to kind of help people, and that is my favorite part of my job, is when you got someone and you could see their face look crazy concerned where they're coming in, and anxiety's through the roof, stressed, and you treat them a handful of times, and then like a couple weeks go by, and then they come back months later, and they're like, can you believe I was stressing out about that, and I was hurting that bad, and if I would have just came here a couple weeks ago, I would have been completely fine. So that's what I like to see, and that's what makes me happy, is truly just someone coming in really really bad shape, just a handful of treatments, they're leaving way better, and then usually their lifestyle is going to change after that too. So that is my spiel this morning, and you guys can tune in today at 1. We're going to talk about the KBMO fit test. Pretty cool, because a lot of people, if you have something serious going on gut GI wise, some people don't like going for lab work. That kind of freaks them out. And then there's a lot of people that don't like sending in a stool sample. That's a really good way to kind of look at someone's good microbiome. But KBMO makes it really easy. So it actually tests your blood, and we do it here. So it's a minimally invasive. It's just a little bit of a finger prick. You're going to take your blood. We send it to the lab in Massachusetts, and around 10 to 14 days, we're going to get the results back. And it basically shows what your body is creating inflammation to and what foods you are sensitive to. And then it actually has something called zonulin, and it tests for that. And so it actually checks, it's actually patented, and one of the first ones to check if you actually have leaky gut, and then the supplement protocol that you could get on to kind of help heal your leaky gut. And then we like to give nutritional advice basically to prevent that from coming back. So myself and Joe are going to be talking about that a little later. So you could tune in at 1 p.m. And then I am back on Friday at 11, I believe, Phil, and we're going to talk about the TPI certification. So that the title is Performance Institute Golf Certification. And then we're going to be doing a demo at 1, I think, over my lunch, our recovery room. So our recovery room has a couple different cool things. So we have an infrared sauna there, and I'll talk about what the infrared sauna does. And then we also have Normatec compression boots, and then we have a vibration plate therapy. So a couple cool things we're going to be talking about a little bit later today and on Friday. So tune back in, and we'll see you guys next time.